All right, here we are, night 2. We in there and hoping to get an assignment. Let's see. Woo-hoo. I just got told that I am going to be assigned the emergency room. I am so excited about this. I'm so excited because I was not trying to be anywhere else. Come on, preach the word of God in this place. So how it is a lot of nurses that came on the last group of hired nurses, apparently they were like different specialties, and a lot of them were uncomfortable doing emergency room and stuff like that, so they refused the assignment. So now they pretty much have a rule that you cannot refuse your assignment. Whatever they give you, you have to take. And some people are very uncomfortable with that. Some people are like, we don't want to take COVID patients. And we're all confused because it's like, who came saying they didn't want to take COVID patients? Like, that's why we're here. How can you say you don't want to take COVID patients? The whole hospital is COVID. So for that reason, the nurses in the ER have been doing like 20 patients. The ratio has been 20 patients to one nurse, or less or more, just depending on the weather. On the last wave, they did not have a lot of ER nurses. So there's like 5 of us here who are ER nurses, and they put like maybe 3 or 4 of us in the ER, and then the rest of the nurses are like on ICU, or pretty much they've opened up units. Like there was a pediatric unit here and other stuff. They closed down their pediatric unit. They've opened up floors that they have never used before to reopen it just for the COVID patients. So there's like a bunch of like kind of makeshift floors that are open now that were never even open before. And it's a full moon tonight. So you know what they say about emergency rooms in a full moon? You never want to work at ER during a full moon. I kid you not, people are crazier. I don't care what anyone says. So we were just told that, charting. I know people are asking me about like documentation and charting. It is not a priority. We do need to chart, of course, and patient safety is number one. So, making sure to be there for the patient, pass medications. As far as all like lawsuits and liability in New York, so the medical liability has been lifted in New York. So like in nursing, they're always like, if you didn't chart it, you didn't do it. Someone brings you to court, you need to be able to stand by your documentation and stuff like that. Well, that has been kind of like omitted in a sense in New York right now. Just like licensure. I'm gonna make a video one of these days in one of these things to kind of just let you guys know how I got in and what the process was, because I don't think I ever really told you guys my process on how I got in and what I had to do and the rules and stuff like that. But a lot of the legal stuff in New York has been lifted right now because they're in mass crisis mode, which just means like, yo, save who you can save. So that's kind of like cool, good in a sense, because as nurses, charting takes up so much time. So if it's like, you're just kind of charting very minimally the important stuff, enough to, just have certain things documented, like that's going to save so much time, and in turn, just kind of make things easier. So that's good. So something that's kind of like annoying is like, usually when the CDC, the Center for Disease Control, says something, we usually like, oh, CDC said that's great research, whatever. But now CDC is like losing their validity for us, because everything that we've ever been taught in nursing, like what to not do, all of a sudden CDC is saying it's okay. Like gloves, we were always taught, we used to put gloves, clean gloves underneath our dirty gloves, so that way, like when we put in a Foley catheter, we would take off our sterile gloves and have like clean gloves underneath and be able to finish taping it to the leg, just all kind of stuff. And you cannot have clean gloves underneath gloves, you have to do one-time use gloves, and you cannot reuse your mask, one mask per patient. I mean, like all these things. And now all of a sudden CDC, every day CDC is coming out with something new. Oh, it's okay to reuse your gloves. It's okay to put hand sanitizer on your gloves. It doesn't break down the barrier anymore. Oh, no problem. Oh, it's okay to reuse your mask for 3-4 days. Like, who's paying the CDC to just like keep changing their mind every day? And so as nurses, we are starting to really like not really believe the CDC anymore, like how we used to just kind of be like, oh, CDC says this. But CDC is changing their research now every other day and just adding their name to it. And it's just like, okay, CD's nuts. Okay, I'm just joking. Don't see these nuts, but yeah. Another thing is that like a lot of nurses here have not worked at any other nursing facility before, and you can tell because they have a different mindset. Like, they come in and all they do is compare it to their old hospital. Like, back at home, this is how we do it. Back at home, like, that is not the mindset you want to have. When you go somewhere as a travel nurse or as an additional staff, you're not there to tell them how to better manage their job, or how your hospital does it like this and how they should acquire this. This is how they do it. Whether you like it or not, either you're going to do it like that, or you just don't say anything and you do it like how you're going to do it, which you think is the safer way when they're not around. But people who have not worked in other places, they come with a different expectation of like, this is not safe. You guys look at it like this, and it's like, I compare it to dating multiple people. Okay, when you've had like 15 girlfriends or 15 boyfriends, you know that they all had good things about them and they all had bad things about them. You don't even need to have 15. If you could have had 5 boyfriends or 5 girlfriends, you like this about Joe, you don't like this about Joe. You like this about Bob. Bob does this better. Rebecca does this better. It's just the same way with hospitals. You go to one hospital, they do it better like this, but then they suck at this. There's no need to be like, oh, Becky did it like this. Susan, why can't you be like Becky? Like, listen, you're with Susan now, okay? Like, and so for me, I feel like, theoretically speaking, I feel like I've had like 15 boyfriends because I've worked at like 15 different hospitals or so. And so like, I'm so used to like, just when in Rome, do as Romans do, or don't do as Romans do, and just shut up about it. Like, that is honestly the only way to get through, because if you keep on bringing up, why do they do it like this? And why do they do it like that? It's going to stress you out, and you're going to be arguing with people to try to see your point, and they're not here to see your point. If they say, oh, you don't need to scrub the hub when you're putting in medication, alcohol is not necessary, and you're like, that's not true. There's no need to say that's not true. Keep it to yourself and just be like, okay, you guys do it like that, okay. And then when you go on the floor, you take your little alcohol wipe and you scrub the hub. Call it a day, okay? Pick your battles wisely. Don't waste your energy trying to get people to see your point of view and your perspective. In addition to all of that, a lot of nurses are leaving because the actual nurses that work here, the staff nurses, they do not like us being here, which is kind of ironic because, you would think they'd be happy for the help, but they're just upset, because they feel like we're taking their money, or they're calling us useless. And, because a lot of people are not very competent, because we come to help, but sometimes they put you on units that you're not competent with. Like, for example, luckily I got ER and that's my specialty, so I should be of actual use. But let's say they put me on ICU or something like that. I've never worked ICU. I mean, I can manage, enough. But if it came to like titrating ventilation settings and all that stuff like that, I can do bare minimum ventilation settings, because in the ER we get people on the ventilators, but we don't take care of them long term. So I would need some help if I were on the ICU in doing some of those ventilator settings and stuff like that. They might be mad at me for that, but they're very upset about us. A lot of them are upset about us being here instead of being grateful for our help. But that's how they are with travel nursing too. Like, if any of you guys have done travel nursing, a lot of times you are not liked. And it's not your job to be liked. You're there to help and help the patients. And in turn, when you focus your mind on helping others and helping the patients, and they realize that you're not there for the money, or that's not your primary goal, or that you actually care and you want to help them and you're there for them, they quickly change their mind about you. Oh, Monique is nice, or oh, Samantha's not, she's knowledgeable, or she's team oriented, or she's actually here to help. She's not here to just take up space. So that's another thing. And some of the nurses are mad about that. Like, oh, why are they mad at us? We're here to help. Then I'll go home then. I'm like, listen, honey, stop taking offense. Stop taking offense because they're not happy that we're here. No, you don't have to people don't have to be happy that you're here. Like, that's not what you're here for. Stay focused. Holy smokes. Holy freaking smokes, okay? That's all I gotta say. That's all I got to say. It is 6:15 and I am just now taking my break. I get off at 7:30. Look at my nose. It's like deformed from the mask. What the heck? I look like a freaking Michael Jackson. So So you're telling me a mouse ran across your feet in the break room?
Yes.
A mouse or a rat?
A little mouse.
Just one or friends?
I don't know. I don't know if it's the same one. I didn't ask his name. We weren't introduced.
Was it Ratatouille or what? Oh, I didn't see any mouse. And where did you see cockroaches?
In the atrium while we were sitting there.
Seriously? The atrium is so pretty.
Oh my God.
Oh my gosh, my face is dry. I'm breaking out. This mask, the first thing I'm gonna do when life resumes is get a facial. Because, oh my gosh, just all of this wear and tear on my face. Ugh, oh my gosh, look at my nose. I look a mess. Okay? Look at this. What is even going on? All this headgear, goggles, lips chapped. Look at this. Whose son? Whose son am I? Just call me Marco. When you work night shift in New York City and you try to sleep in the daytime, I be getting no sleep, okay? No sleep. Baby, right outside my window, going ham. Oh boy, okay. Let's recap. Where do I start? First of all, I'm gonna have to wash my hair like every day before I go to bed, which is gonna suck because there's nothing worse than going to bed with wet hair. And I have to actually use shampoo because like the smell is in my hair. Like you can just, even though I have a hat on the whole time and a cap, I'm just like, I just have to wash my hair. So this should be interesting because, you know, black girls, we don't wash our hair every day. So I'm really having to put all this extra moisturizing stuff in it and stuff. So that in and of itself is going to be a battle. Okay, so upon walking into the ER, let's recap. So when I first became an ER nurse, I remember the very first time I walked into an ER, Huntsville Hospital, 2013, October. And prior to then, I don't think I had ever even I shadowed. I don't think I'd ever been in an ER. And I remember seeing like a patient come in on a respiratory. I mean, it was like, I remember having like a panic attack inside. Like, I don't think I can work here. Like, I remember being like, oh, heck no. Like, and my boss was walking me through the ER like, oh yeah, this is pod A and this is pod. And I was like toning out everything she was saying because I was just like, holy freaking smokes. And then then I conquered it and I ended up loving the ER. And I always kind of laugh and smile about that day and how scared I was and how I was like, oh, heck no, I can't do this. And I had so much I guess, I don't know. I was just so scared. I never had been around like so many acutely sick patients and stuff. So I hadn't had that feeling again in a long time, like years, until today. I walked into that ER and the same feeling that I had when I walked into Huntsville Hospital ER in 2013 was the same feeling I had when I walked into this ER. I was like, what in the heck? My heart was just like, bro, you should have seen. There were patients everywhere. Oh my gosh. Like, it looked like a war zone. Like, you can even walk. I mean, I am used to busy ERs. I'm used to having hallway patients. Like, I'm used to that stuff. It's not a big, whatever. It sucks. I've had ERs where patients have been lined up throughout the hallways. It's like, okay, cool. Nah, B, this is something completely different. It's like something I've never seen before. There's like 4 or 5 patients in one hall bed. There's like, 3 patients in one room. It's just like 3 patients in one room, like sardines together, like blood on the floor, diarrhea, everyone's coughing, people are walking. Why are you walking in the hallway? Like, go, like, you're mad contaminant. Like, what are you doing? It's just like, the amount of different secretion, the diarrhea, the smell, the stench of that ER, of just the bodies. I mean, I just was nauseous walking in there. And it's hot in there. Why is it hot? What is even going on? It was just gross. There are people reaching out their hand like, help me. I'm like, yo, what in the, like, grabbing you. Help me. Like, in the middle of the hallway, like, Walking Dead. Like, it's like mind-boggling. I had never seen it. Like, people are just laying there like, I'm dying, and I'm like, oh my gosh. And everybody has their own wishes. So you have some people who are like, do not resuscitate. Some people are do not intubate. Right? So if you're do not resuscitate and do not intubate and you're not doing well, you're literally just gonna be there, right? Like, if you're going downhill, we do as much as we can until like we can't do anything. So there's people literally just sitting there dying. Literally. It's wild. Like, so many people are dying and have died. So many people died. I think our hospital is about 30 people are dying a shift or so. It's literally wild. Like, I can't get so much into it because, HIPAA, privacy, patient privacy, but OMG, like, it's bad. It's like very bad. I'm just like, I was like, oh, she's not gonna die. Yeah, no. It's really sad because, the families can't be with their loved one when they're passing away. So we're like trying to call them, FaceTime with them, trying to keep them as involved as possible without being there. So that's like really sad. Unfortunately, a lot of people did pass, including my patient. And it's just, man, that joint is wild. I'm thinking people went to x-ray. I'm like, hey, where did that patient go? They went to x-ray? Nope, they went to the morgue. What? Like that? Like, we just falling out like that? I mean, y'all, it's like crazy. Like, the way the ambulances are coming in. I mean, I wish, of course, privacy, I can't, but I wish that I could just show you guys what it looks like. I mean, it's wild. I feel like I'm in World War II. It's like bunkers. Like, I don't know. It's the mindset of the people, the way that people are. They're so hopeless. You see it in their eyes. They're just know they're dying, and it's sad. And I have to try to detach myself from feeling that empathy and just kind of like close it off, or else I can't do my work. You have like the American Red Cross calling, trying to get people, possibly out of the military to come and visit their family and loved ones. And it's just, you guys, I've never seen something like this before. You're fighting, or not fighting, but you're discussing over, there's one vent, there's this vent left, there's only one spot in ICU, who gets it, who stays, who's not. It's like these decisions you have to make about lives, of like who needs it more than the other and stuff like that. Like, that right there is real. It's just like, I've seen it happen with my own eyes, of like, choosing something over the other because of lack of one more spot, who gets it. It's just so sad. It's so sad. It really is. And you can't like really be sad in the moment, because you have to keep on going, right? And so if you get too caught up like being sad, like, you're screwed. When I first started the shift, I was like just having kind of anxiety for like the first hour. I was like, between the mask, I couldn't breathe. It's just hard to breathe and all that PPE. And then sometimes you feel like the protective equipment is not working, and you start getting paranoid, like, I'm breathing. And then it's like, when you're in the store and someone coughs or sneezes, you're like, excuse me, honey, you probably got corona. But then it's another thing when you're like there and they're coughing and sneezing and they got corona, right? So you're like, ah, and they're hacking up and coughing up blood, and you're like, like, I'm not even joking, like, you actually got the Rona. So it's like, they have it, and they are like coughing and sneezing everywhere and spitting, and you're just like, please, mask, please be working. You're just like, I hope this mask works, because if it doesn't, boy, we got the roans. So let's pray that my mask is working, because Lord have mercy, the way that these people coughing and sneezing and spitting and vomiting and diarrheaing and everything, oh, woo, thank God for the shower. On the other side, I felt very blessed, because the girl that was in our pod, she was like our expert nurse in a sense. She was so nice. She was so sweet. She's an actual staff there. she was so helpful. Like, I try not to ask her too many questions, but there were just certain things I needed to know. And even though she was busy and there was a trauma coming in or there was this, she was still like so kind and helpful. And she was like an angel. I was like, I love her. Like, when I leave, I am buying her a card. You know, I was prepared to just be around mean, nasty people, because usually the staff is really mean to us because they usually don't like outsiders. And everyone else has been having very bad experiences with staff being mean to them, hiding stuff from them, not trying to help them, blah, blah, blah. So I was prepared for that. But I mean, she was literally nicer to me than my own coworkers that are at home or that I've ever worked. I mean, I love this girl. I love her. And she works tonight too, and I'm just grateful. Another thing is, you know, in the ERs, they have different sections. So they put me in the worst section. It's like the trauma sick sections, which is why I had so many sick patients and why I think so many people were passing away in my section and why it was so crazy. So I know that with that said, there are other sections in the ER. So hopefully I get alternated throughout the ER, and that will help just kind of prevent me from getting burnt out, because hopefully I'm just not in that super critical section every night. Because some of my other coworkers that were in the ER were not in that super critical section. So hopefully we switch it up, and that will really help not have burnout. And I'll probably ask them if I notice that they're not switching it up, I'll be like, excuse me, can I get out of the green and go over to the blue for a sec? Thanks. Also, the girl that is an angel that I really liked, she was telling me, she was like, tonight is absolutely mad. I was like, oh, is it not usually like this? She said she's been working here for a year. She was like, I've been working here for a year, and I have never seen this many people in the ER. And I was like, oh, so it's not usually like this? She was like, I mean, it's busy. She's like, but it's not usually like this. And I was like, wow, that's comforting to know that I started on a mad night. Of course, it was a full moon. I told you about that full moon. But it's kind of nice to know that, like, today was probably, like, the worst, like, you know, as far as, like, it wasn't, you know, like, if you start a new job and it's like, oh, today's a slow day, then you think your job's all easy, and then you get got later on when you're like, oh, this job is easy, and then a busy day comes, and you're like, oh, what's this? It's kind of nice to start off, like, in the super hard and critical pod and start off on a super busy day. And it's just like, in a sense, it only gets better from there. It's only up from, like, it's like today was so bad. It's like it only goes up from here. Those are the hopes. But we're also in the peak of the corona, so who knows? This could be the new beginning. But it was packed. So it was kind of nice and comforting to hear that last night was an unusual night, and that is not the norm. So we're hoping it'll go up from there. You know, it was crazy. I probably need counseling after this. But, let me go to sleep. I'll keep you guys informed. Alrighty, bye. Oh, I did just want to tell you guys this. If you have a family member or someone who, like, they get injured, I don't know, they're walking outside and they fall and hurt their knee. Oh, I'm going to go to the ER. Please do not go to the ER right now. Like, I beg of you, because people were coming into the ER for, like, non-corona problems. Like, oh, I fell and hurt my knee. Like, stupid crap like that. You've got to be freaking kidding me. Like, you going to the ER for something minor, like toe pain, knee pain, you fell, you have this, like, stuff like that. Like, don't do that right now, because you're going to put yourself at high risk for developing corona. Like, all these people that came to the ER for stupid crap, I'm just looking at, not stupid, but, you know, whatever, non-lethal stuff. I'm just like, no, go home. Like, you're sitting here in the ER for 3 hours waiting for x-ray, waiting for this. Like, you are being exposed. You're around, you know, 40, 50 other people who have coronavirus. Like, please do not let your family member or you do not go to the emergency room at this time for, like, minor to moderate things. Like, please just wait. Please. Like, I was like, oh my gosh, like, so heartfelt for my patients not mine, but for the patients who were there for non-corona problems. However, at this time, literally like 95% of the people in the hospital and in the ER are there for corona. 95%. So it's really only like 5% of the hospital that's not corona right now. So you're literally walking into a corona zone if you come to the hospital. So please don't come to the hospital unless it's emergent. Please.